I know we're on a little time crunch today, so we'll go ahead and dive into it. And
Yeah,
unfortunately,
let's jump in.
I don't think Rick's going to be joining us today. I
Okay.
promised that he'd be in on this, but he's been a busy man. And
All right.
but
Well
no
then, I mean,
worries.
we'll figure something out.
Yeah, we'll jump into it. So now, welcome everyone to today's webinar session. My name is Ray Walters. I will be your host, and I work with Epi Compliance. I'm also joined by my co-host, Mr. Jose Delgado Jr. For those that might be tuning in for the first time, Jose's got 20 plus years of experience in healthcare consulting, currently owns and operates a mental telehealth clinic. And we've been on a little bit of a HIPAA security, I guess, tick as of recent. We talked about a DaVita ransomware attack last week. And
Yep.
then today's session, we're going to talk a little bit about a couple more cases, Yale and Blue Shield of California.
So I wanted to pivot a little bit since Rick isn't here.
Sure.
Maybe he'll be here in the future and we can set up the Yale conversation. The Blue Cross one is interesting because it's one it happened accidentally on purpose. It wasn't the intent behind what happened, but it is what happened, right? And then
Right.
I did want to talk about the thing I was talking to you about where somebody's trying to pull off meaningful use stage 3. So lots of stuff to get into. We got about 40 minutes or so. Um so
Yeah, we can dive in.
the TLDR for the Blue Cross Blue Shield case is this. They had partnered with Google Analytics for to conduct targeted marketing. The problem is that they didn't have the approval
Hmm.
because now it's healthcare. The analytics portion did not have a business associate agreement, and they were not taking several steps to make sure that those 4.7 million lives were protected on all the data that they recovered or received, right? So what's the problem with this? Google Analytics, I'm sure everybody knows what's going on there. If you're using Chrome, which most people do, anytime you're using a search engine like Google, it's tracking that data. And you can influence Google to not necessarily suppress others, but to push your wanted result to the top. So how do they do this? They just quite simply track everything that's going on. Every search, keywords, boom,
Yep.
boom, insurance, Blue Cross, California, perfect. And they pay for it to go to the top. Now, what they'll also do, and another way that Google Analytics gets involved, is when you click on the website. So the sponsored ad is usually the number one, and then you go to the free ones after that, right? There are also ads on websites. And if you click those as well, those are generally ads that between the search engine and the person hosting the website, they share in that revenue, but they also share in that data. So again, you didn't know that you were supposed to do this. Probably what happened was this. Marketing got overzealous,
Hmm.
wanted to get as much data as they could so they could help pump up the numbers as much as they can because it's Blue Cross. That's just how that goes. They want to go as hard into the paint as possible because it's a finite amount of lives. Perfect. But you didn't check in with legal, and so you got your hand caught in the cookie jar. So it's very now, how does this translate to more of our target market? It's very, very, very simple. This can happen to a smaller office in 100 different ways. And it's going to be, they're going to get dinged for like $4 million, whatever. But for
Slap
a
on the
company like
wrist.
that, it doesn't matter. For a company like most of our clientele, that'll bankrupt us. It won't
Absolutely.
just kill the business financially, it'll also kill us personally. And because our practices are generally attached to someone with a license of some kind, the state tends to take the license as well. There's no one licensed to take at Blue Cross Blue Shield or at Aetna or United or Cigna. So the penalties are very, 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 very different. It is very much a rules for thee, not for me kind of situation. But these are the cards we're dealt. So if we're a small office and we're wanting to be very aggressive with our marketing, we have to be careful how we market. That's the basics of it. If I have a social media atmosphere and I'm in the healthcare field and I'm marketing healthcare services, then I need to make sure that one, any pictures of my office, everyone signs off that they consent to being on the social media. You can do that with your initial patient paperwork. Hey, from time to time, we'll be doing marketing. You can opt out, but if not, you sign the initial patient paperwork, you're opting into being on regular media. And then there's other ways as well that you can have situations where, hey, you had a positive experience with us, please leave a review. And then we've talked about this before. Dealing with positive reviews is easy because they're volunteering information. Dealing
Sure.
with negative reviews is difficult to combat because we can only deal with the information that they have given out publicly. We can't add context. We can't add anything to it because then we're violating HIPAA. If we're using social media, if we're using TikTok, if we're using YouTube and we're doing videos and we have patients, now this is where AdSense can get involved with some of these things if we have a large enough channel. Now you have a problem of you need to make sure that you have a BAA for YouTube, if you can get one with YouTube or with TikTok or with Instagram or with um,
About
Kick or any of these streaming websites, if you're doing tutorials, anybody involved with that, you need to have consents.
I've had customers in the past that have had patient raffles, you know,
So a
uh,
patient,
and
so
obviously
it's the
advertising
patient
on
raffle isn't the
Facebook and
problem. Yeah, the
uh,
patient raffle isn't the problem.
social media part.
It's the social media and it's the broadcasting because if you're doing a raffle, you're not doing it out of the kindness of your heart to give stuff away for free. You're doing it because you want to market the business and use
Yep,
this as a marketing tool. But if everybody involved does not consent, then you really can't use that
that's an
winner in
issue.
your marketing material. So what's the point? Now, you can do that as a separate piece as well. Hey, if you're going to be part of the raffle, you have to consent because if you win, we want to use this for marketing. Most people won't care. You move on with your life, right? It's again, it goes back to the same situation where it's all about that documentation. You've got to think three, this is chess, not checkers. You got to think three steps ahead and assume ill intent on everyone's part in order to properly protect yourself. Because it's not just the private market and the patients and ambulance chasers that are trying to sue us, but it's also the federal government that's trying to put the screws to us. So we have to be careful. All right. And that
Jose,
kind of brings me to the next. Huh?
I was gonna say, um, what other things should privacy and security officers be concerned about, obviously, when dealing with your websites? What should they be looking
Um,
for? I mean, obviously the social media stuff's one
the
thing,
social
but
media, the analytics. If someone is, and this is one I see a lot too, since you mentioned it, if someone is submitting information to through the website to your practice, who has access to that email?
yeah, yeah,
You want to limit that
I'm gonna
access as
limit
much
it.
as possible. But the problem is you may have a small office and you may have high turnover or even medium turnover. And one person every 12 months, a different person every 12 months has access to that email that is receiving referrals, that is receiving new patient requests, that is receiving appointment requests. All of a sudden, you could be losing a ton of patients at best, or you could have a giant breach on your end because an overzealous employee put it on their phone. They have access to it. They left the practice, whether voluntarily or involuntarily. Life happens. And now all of a sudden, they're not part of the practice, but they have access to all these their new patient paperwork. There's data in there that would be personally identifiable. And because it's health nature, it's not just, you know what I mean? So
Yeah,
you start going down a rabbit hole there because it can be a PHI issue, it can be a financial issue if there's any kind of financial information on this paperwork. It can be, it just goes down the list of problems. So if you are using one of those methods of capturing and marketing to people, make sure that you have a very tight circle and that every time that person that has that responsibility leaves, you got to change the password. You got to change the password, the credentials to get in there. All right. Um, and just because we're running tight on time, I did want to go over this other one, the the meaningful use one. And I call it the meaningful use one because Epic and the federal government, if you go far back enough to where you billing was done on paper and there were no EHRs, Epic and the federal government have decided to try to implement meaningful use stage three. So again, I'm going to try to keep it nice and tight and condensed. And if you want more on that topic, or if you want to look it up, these are the keywords. Back before macro MIPS, there was something called meaningful use. And what it was the carrot and stick method that the federal government was giving the healthcare industry in order to, well, carrot or stick us into using the EHRs in a meaningful manner. The first one was all about capturing data. The stage one was just capture data, use the EHR, prove that you're using the EHR. Stage two was more along the lines of, can it improve patient outcomes? Are you submitting claims? Are you submitting referrals, scripts? So not just for pharmacies, but also for imaging or for specialists. Are you submitting that stuff through stage two? That was so stage one was between 2011 2012. That was carrot or stick, but they were mentioning it all the way back from when the Affordable Care Act was passed. Stage two was 2014, and they stopped at stage two. And the reason was because everyone knew as soon as they mentioned what stage three encompassed, it was an impossibility. And my problem is that it hasn't gotten more impossible. It hasn't gotten less impossible since 2016. It's gotten more impossible. And here for a completely different reason. The idea behind meaningful use stage three was that everyone was going to stop using their personal servers and their personal EHRs for their practices. And the EHRs were merely going to be bridges to one network that had every single patient in the United States' data. It was going to be federally stored, and all the EHRs were doing were just connecting and pulling and adding data. And the idea behind this was that this way we can prevent duplicative measures. We can have the most complete data for every patient possible, because if you've been in healthcare for more than 6 months, you know this. It's not that patients don't want to give you all the information possible to do your job. It's just that sometimes they don't know what they're supposed to give you, or they forgot, or they don't have it, or they don't think it's important, or their spouse has it, or their mother has it, or their kid, like it just goes down a bloody rabbit hole. And I'm sure that some of you that are just twitching just hearing this stuff because you've experienced it. So what was the problem? Back in 2008, 2009, when it came up, it was the problem of programmers did not want to give everyone access to their code. Because the idea would be, if everyone has access to this database where all of the records are held, then that means that everyone's code has to be readable. That bridge has to be the same for them to connect. And nobody was willing and wanting to do that. Now we have a different problem entirely. Now, Epic has partnered with the federal government to create this database, and they just put online there are 1,000 hospitals and there are 22,000 outpatient practices. All the while, we are having all of these cybersecurity breaches.
Yep.
Everywhere, on every aspect, from stupid low-level stuff that are human error to higher level server hacks and Trojan horse situations where your IT is downloading bad update packets, and in there is an extra line of code that gives a hacker access to a ransomware everything. I don't, it's not a matter of when this goes bad. In my opinion, it's how quickly. For me, now that they actually put out um the name of it, the TEFCA, the Trusted Exchange Framework and Common Agreement, I have no doubt in my mind that this is going to be a mess. This is going to be a giant mess. And what I don't know is how it's going to affect when this occurs, because it's going to be very hard for them to isolate where a breach comes in. But once the breach has occurred, how do they stop it from spreading like wildfire and corrupting all of the data that is in this framework, that is in this exchange? I mean,
It's going to be interesting.
you're talking
Just
about millions of lives, 22,000 clinics and 1,000 hospitals. Uh,
it's a lot.
Tens of millions of lives are going to be on this, and you have no choice. If your hospital or your clinic is using Epic, they're going to be connected. I'm curious to see what rights a patient has, because if there's a breach and the breach is from this exchange, this TEFCA, who are you going to sue? The federal government? How are you going to know? How are you going to know which office to sue? Does this automatically mean that I can punt my liability onto the EHR company because now Epic is an EHR company along with a partner in this exchange? So does this automatically create
They take the blame.
Epic? Yeah, like where the amount of just what were we thinking? And the thinking is Epic got federal money to help do this. I want to say that I saw that the number was like a couple mil to partner with the federal government to do this. And they started this in 2022. So they've been working on it for a while, but they announced its goal for the entire Epic community to be on Tefka by the end of 25. And this information is just being released to everybody now. If you are on Epic EHR or if you're a representative of Epic EHR, I'd love to talk to you.
Says that they haven't publicly disclosed the total cost of the partnership with the federal
Oh,
government.
it's going to be in the hundreds of millions.
Yeah,
It's a private tech company charging the taxpayers. You think it's going to be cheaper or more expensive? Give me a break.
yeah.
The problem is the problem is it's the proverbial right. Like if we're talking about patient security, patient security, patient security, patient security, we have to be hyper vigilant. This isn't a vault anymore. This is one of those rounded doors because how many different systems are going to have that same bridge code? And once you have that bridge code, which any person that's working at any EHR that wants to work on this exchange is going to have the raw bridge code to connect. And this is if you're inside. If this is an inside issue, if this is an exterior issue, the second I have access to your Epic's EHR, I have access to the entire hive. You just gave me a way in. How's that? Would it be possible for someone to shut down that entire cloud? Absolutely.
Say
You'd be
so.
naive not to. The trick is how quickly are they going to be able to get back up and running? How quickly are they going to catch a malicious intent when you have 1,000 hospitals and 22,000 clinics that could be accessing this at all hours of the day, every single day, 365? I don't know how you track this. I don't know how you monitor this. I don't know how you police this because with the way that the laws are written
Putting
and the
all your eggs
intent,
in one basket, essentially.
I mean, it's all your eggs in one basket and putting a giant sign for all the wolves come in to steal and all the foxes to come in and steal. Like you don't even have to hide anymore. If you have the code, I don't know how they're going to, I have no idea how they're going to protect this data. None. Because in order for it to work, it has to be amorphous. Even
Mhm.
if we went through the trouble of saying, hey, no, Jose, you're crazy. This bridge code is going to be slightly different for every single EHR. Okay, boo boo, perfect. Let's go ahead and say that. How many hospitals and outpatient offices does Veradigm have? Veradigm is all scripts and practice fusion. Epic has 1,000 hospitals and 22,000 clinics. Athena is massive. eClinicals is massive. How are you going to isolate that down from the source to the vendor to the individual client? To then do it from the individual client to the user. And you're going to do that all before they lock you out? Never going to
No way.
happen.
No way.
Never going to happen. When you're seeing that people are taking over whole systems with a bad email, you know what I mean? Like,
Yep.
what? No, and there is no shot.
It's
Start the clock.
it's
If
bound
there's
to
not a
happen.
breach, if there's not a breach by the end of 2025, I will be shocked.
If there isn't, then we can approach this again and
Oh,
see
I
what
hope that. I
and see
hope.
what they're
You know
doing.
what? Either way, put
See
it
what
on the schedule for the last topic of the year.
yeah, we should. We should.
Because if there isn't, I'll be absolutely shocked, and I'm gonna want to know why. If there is, I want to know how they didn't catch it coming in.
No, it's just a matter of time in my opinion. Just a
But
matter
I
of
want to
time.
know, all right, if someone when someone is able to access this information, are they going to be able to break up that entire cloud database? Or are they only going to be able to break up a section? But I don't know how you
Right.
could do it by section because if the idea behind meaningful use stage 3 and this cloud database is that I can travel from here to New York to California to Colorado to Alaska to Hawaii to Puerto Rico to Guam, all over the US, and I never have to take my patient record with me. I don't have to have a medical record custodian because they can just access my information magically through the cloud and compile it from everywhere I've been. How are you going to protect that data? How are you going to know it's me? My
Keep
father and I have the same first and last name. Do you know how many times people get me mixed up with him? And he's 40 years older than me, 30 years old, almost 30 years older than me. So, I mean, it's it's going to happen, and I'm very, very curious to see how it goes. Is this going to be something where, hey, most people that are in the southeast are going to stay in the southeast, so they're going to kind of silo the data to the southeast server, for lack of a better term, and then if somebody breaches, they just shut down the southeast corridor? Like, what? How are they structuring this?
You know what? Better yet, it's how are they even notifying patients that this change is coming into
Patients don't
effect?
know this.
Yeah, exactly.
Patients don't
They
know this.
don't.
I guarantee, actually, you know what? I'll
They
go one
don't.
step further. I guarantee you that 90%
Providers don't know
of
either.
Epic's clients don't know this is happening.
Yeesh.
90%.
That's a sure
I'm
sign
that
right
confident.
there that it's gonna fail.
Uh,
I said that seems like a sure sign that it's gonna fail.
well, here's why.
Not even.
Here's why I say 90%. Because most people don't understand the basic level IT and they honestly don't care. Just do your job, leave me alone. I don't care as long as it's safe and secure. I don't
Sure.
care. I'm sure some people don't understand that their data is going onto this cloud. At what point does my responsibility stop as part of that medical record when you have a whole bunch of other data from other places coming in as part of that record? Like, how does that change malpractice? How does this change even that the insurance companies are going to have access to this data too,
Hmm. Yep.
because they
Yep.
already have access to whatever meds you're on through the MIB. So you think they're not going to have access to your complete medical record once this is done? They're not even going to bother. They're just going to be like, all right, Bob Jones. All right. Well, Bob Jones, he broke his leg in Colorado when he went skiing last year, and he's done follow-ups, and he's a 45-year-old male with hypertension. Well, let's jack that up because he travels. He cost us a lot of money last year because he went out of state, out of our network to a hospital in Aspen, Colorado. You know that's what they're going to do. And they're going to have all of that data there. This is going to be a mess because I don't think they thought this through. I really don't. I mean, if anybody's got a different opinion, I'd love to hear it. And I'd love to hear not just I'm wrong, but I'm wrong because and give me, because this just seems like a this can you should have seen this coming. You know what I mean? When this breach happens, I'm going to sit here and say you should have seen this coming. But I'm concerned because how does this affect me? If I'm one of the clinics that's on Epic and the breach comes from Epic, are they going to shut all of Epic systems down? Like how are they going to silo this when the breach occurs? I mean, are you going to just kill the client? You know what I mean? Like what's the backup to this entire database? The amount of data you're going to need.
Only time will tell.
I mean,
Well, you
and
saw the
again,
what the Change Healthcare their entire EMR was down. So
well,
right?
it wasn't just, well, no, no, no. So that's a great point. So change isn't even an EHR. They're a freaking processor. You know what I mean? Like
Yeah,
the data was never stored at change. They're a pass through. And they shut down everybody that was using Athena, that was pushing claims through
that's
them.
right. Athena. That's right.
And they
That's
have
who they had to
a
deal
couple
with.
other EHRs, but Athena was their big
There's
boy.
another one too. I'm trying to remember,
There's
but
another big one,
yeah,
but Athena was the big boy,
yeah.
especially over here in the East Coast. So what are we doing? Now it makes me think that if I'm on Epic or on an EHR that is going to be part of this database, I need to have a backup that, I hate to put it this way, but I may need to go back to having a server. And I don't want that. The cost of having and maintaining a server is, oh, it's annoying. I just don't know. I don't know why this wasn't thought through. So this is going to be very, very interesting. And I don't want to doom and gloom everybody, but for me, this is huge. This is a huge point of contention for me. If you're using Epic EHR, absolutely ask them these questions because I highly doubt that they're going to allow you to opt in or opt out. I highly doubt that.
Well,
So if
especially
they're
if they're
not going
not
to allow you to
notifying
opt
you.
in, yeah, if they're not going to allow you to opt in or opt out because they're going to say that, hey, we're just storing the data someplace else. So that doesn't affect you because anytime we change servers or change server farms, we don't have to notify you. So why would we notify you of this? I mean, they got to notify you somehow of something because when you see, I imagine, again, I don't know, but I imagine if the entire point is for me to have all of the data possible about my patients, then there's going to be data in my EHR that pops up that no one on my team compiled or
Hmm.
created because that information was submitted to the cloud. How is that going to be structured? How are we going to know that patient information is accurate? Like this, the implications here and the level of AI use they're going to need just to sort this freaking data is wild. It's wild. Because I can't, if anybody has ever tried to move data from one database to another database, and every single time an IT person tells me, oh, it's the same format, it should be fine.
No,
Tell me how many times you've found a mistake, small or large. It's not a matter of if, it's small or large mistake.
Yep.
and it can be in the same freaking format. You can have look anybody who deals with coworkers that are in an Apple environment and an Windows environment. How many times can you get a product from them? Hey, we got this Excel document we need to knock out, this PowerPoint, this Word document. You guys send it back and forth, and all of a sudden the formatting's all screwed up. Or you can't even open the thing because it's corrupted somehow. And that is using the same freaking program. You're gonna tell me that this complex stuff isn't gonna have a problem? Oh man, miss me. Miss me. But no, so we're reaching my heart out. If we've got any questions or concerns, definitely, guys, feel free to reach out. Like I said, this one is more, hey, heads up, this is what's going on. If you guys have any questions or you want to go over some strategies on how to prevent this from affecting you or minimizing its effect, I'd be more than happy to brainstorm either on the podcast or more specifically with you guys. And I know Ray would as well.
No, absolutely. If you guys
Um,
have any questions, concerns, feel free to reach out to Jose or myself. I appreciate everybody that attended today. Hope you found this valuable. Certainly going to be interesting to see what will happen here over the
oh
next
yeah.
couple months.
Yeah,
And
yeah, yeah. And then next week you've got Dr. Delgado.
yeah, next week Jose is going to be out, but it'll be myself and Dr. Delgado, and he wanted to talk about sort of the this kind of dovetails into it a little bit, but just the 2025 developments and Medicaid programs. He wanted to
Oh
talk
yeah, yeah.
on
Medicaid specifically. Medicaid's gotten a lot of changes.
sort of the global trade tariffs affecting healthcare finances,
Yeah.
um,
Yeah.
evolving insurance regulations, and we did want to touch on a little bit of the some of the AI stuff as well. So, um,
Nice.
yeah, looking forward to that. And Jose, I forget where are you? I know you're
I'm going an hour west of Alabama.
nice,
Birmingham, Alabama.
very nice.
Yeah. Yep. So if I
Well,
can get on with a signal booster, I'll try.
yeah, right. Yeah, good luck with that.
So,
Well,
but no, guys, thanks.
enjoy your time off, and yeah, like I said, everyone, we'll be sending out the registration link. Just be on the lookout for that, and hope to see everybody next week. Jose, appreciate your time as always.
Thanks, man. Have a good one.
Take care, everyone.
Bye.